Welcome to the new session of Physiotherapy. Today, we have very esteemed Dr. Arpita Rathod, Associate Professor at Tilak Maharashtra Vidyapeeth, College of Physiotherapy, PhD Scholar, Manual Therapist, Pilates Instructor, and Consultant Physiotherapist, Pune, India. We welcome you, ma'am.
Good morning. Thank you so much, respected Dr. Nupur ma'am, for such a beautiful introduction. My name is Dr. Arpita Rathod. I'm a certified Pilates instructor, a consultant physiotherapist, and associate professor at Tilak Maharashtra Vidyapeeth College of Physiotherapy, Pune. So I am going to present a topic on, I'm going to talk about Pilates and physiotherapy. Pilates, this term seems to be a fitness trend, which is now in a booming, it's going on at a greater pace. So I would like to speak something about it. And I would first like to thank Sancheti College of Physiotherapy for inviting me for this. And it is a wonderful, I feel grateful to share this talk. So, ma'am, next slide. So, Pilates is more than fitness. It is used for rehabilitation. Earlier, uh, uh, a scientist had discovered something called as exercises which can be done on the floor, which can be done on mat. And such exercises he was basically trying to incorporate many of the core strengthening protocol. He was trying to engage in the core muscles into a daily exercise protocol for physiotherapists. So his name was Joseph Pilates. So Pilates has been derived from his name, Joseph Pilates, in 1920s. So yes, he was saying that people should go beyond general fitness, and for general fitness, they should not only focus on limbs or distal extremities, which are which the person is suffering from any certain kind of pain or disability or muscle weakness, but it is something which has to be trained and rehabilitated as a kinetic chain. So it is a clinically effective approach which is used in rehabilitation. It focuses mainly on the core control, body alignment, and functional movement. It supports recovery from various physical conditions. Its growing adoption in physiotherapy reflects its versatility and effectiveness in improving strength, posture, mobility across patient population. As you can see in the next slide, there is a therapist who is giving Pilates exercises. Now, as you see, you might find some fancy equipments there, but Joseph Pilates had said that even if you try to train the human core on the mat, it will definitely help to strengthen the distal extremities. Yes, initially therapists need to train the human, train the patient to how to engage the core muscles while engaging the core muscle and then simultaneously going out for stretching and strengthening exercises of the patient. So, as I have said that history and evolution of Pilates, it was by Joseph Pilates in 1920 as a method to improve physical strength, flexibility, and posture. Originally, it was embraced by dancers and athletes for performance enhancement. Dancers they need a tremendous amount of flexibility when they are performing certain movement. But what was important is that dancers used to maintain, they used to achieve a certain posture, and they used to maintain this posture for certain seconds. So for maintaining the posture, the body posture needs to be aligned and the muscle needs to be strong enough so that the body structure remains in the constant posture. So yeah, it was practiced, and it was the rehabilitation was given to the dancers as well, not for recovering from any injury, but to train and enhance their posture during dancing. for athletes for performance enhancement and injury prevention. It has since evolved into clinical Pilates, a therapeutic approach which is widely used in physiotherapy for rehabilitation and functional recovery. So, role of physiotherapist as Pilates instructor. Being an Pilates instructor, honestly, the patients which I see in my practice is they are not having a proper alignment of the body, the proper alignment of the posture. This leads to certain kind of muscle imbalances. As we all know, there is particular group of muscle which go into shortening and particular group of muscle which go into lengthening, and with due time this certain posture is adapted which leads to or invites new pain. So as a physiotherapist, Pilates is not only used for rehabilitation but also for postural training, and it is a kind of movement science which is given after a particular assessment of the patient, and then the program is being scheduled, the protocol is being decided. They ensure that exercises are both safe and effective. This approach benefits individual recovering from both acute and chronic conditions, supporting long-term functional improvement. As you can see in this image, next slide. As you can see in the image, a Pilates exercise protocol has been given by a therapist. This position is called as the hundreds. It's a protocol which is given by the therapist. It's an exercise for which a Swiss ball is being used. As you see, as a woman, she does the flexion from her thoracic spine, and her hip and knee are into 90 degrees. So she is trying to engage. Activation of core muscle is the basic principle of Pilates. After the activation has been done, earlier we can give the patient a Swiss ball as per the body build of the patient, and then the patient can try to body. Later on, the Swiss ball is removed. This helps the patient to maintain the core transverse abdominis and rectus abdominis and all these muscles. These are actually unsung heroes which are working to maintain your kinetic chain into that aligns with your body posture and thus gives you proper alignment of the body as well as prevention of acute injuries. So next slide, please. Okay. So key principles of Pilates in rehabilitation are, first of all, whenever certain postures in Pilates are being achieved, the first thing we do is centering. Centering means trying to make the patient aware of his own core stability, making him aware about how to activate the core muscles initially, so that the stability is being ensured. And core is basically a cylinder which is covered with muscles of the abdomen. And if those are the strength of those muscles are achieved, or at least whenever we are doing certain movement, the core is aligned, it makes sure that there is less amount of injury or less amount of strain or stress on the distal extremities. Even core strengthening will help, does help athletes for recovering from the acute injury, getting prevented from the acute injury for throwers, for badminton players. So centering is very important. The second principle being breath control. Whenever we are talking about core, and if we don't talk about diaphragm, so it will be wrong. So diaphragmatic, which is diaphragm, which is the main inspiratory muscle, it is responsible for engaging your core muscles and facilitating core engagement while doing extremity movements. So breath control, it helps in coordinating the movement and promoting relaxation. Maximum injury are arising because of lack of coordination in the movement. The third principle is precision, which ensures correct technique, minimizing compensation and promoting efficient movement. Flow, which encourages smooth, continuous motion to support functional transition. Concentration, which enhances body awareness. Whenever we try to give Pilates to our patients, their more focus is on they should not lose the balance when they are attaining or trying to achieve the position. For example, the image which I had shown, that was the hundreds exercise. The name is itself that. So that coordination makes the patient realize that, okay, I have activated my core and I have to maintain this position for certain duration. Then control is vital to perform each movement with intention and stability. Together, these principles, they improve neuromuscular coordination, reduces pain, and support functional rehabilitation. Next slide, please. Yeah, it's just as I explained all the above six principles. So these are nothing but the six principles of Pilates: breathing, concentration, control, centering, flow, and precision. Next slide. So clinical application of Pilates. It is beneficial in chronic low back pain patient. Uh, One of the studies has shown, few RCTs have been conducted on that also, that the generalized protocol, that is low back lumbar stabilization exercises, and all these exercises are effective. But giving Pilates to a patient who is having chronic low back pain more than 3 months, which the pain which is since a year or so, Pilates has shown to break the old pattern, and by training the new patterns to the patient, improving his posture, and thus long-term effectiveness is being encountered only by certain Pilates exercises, because it was indeed improving the core strength and reducing the reoccurrence. In any injury, I feel, whether it is acute or chronic, reoccurrence, if that phenomenon is being looked upon, so if we try to reduce the reoccurrence of same pain, the pattern won't be formed. And thus the patient would recover at a faster pace, and indeed we would get good results. It is effective in postural syndromes through realignment and muscular balance. Muscular balance, as I have just said, that certain group of muscle due to postural adaptability goes into shortening and lengthening. So targeting the muscles who are lengthened to strengthen those lengthened muscles, and trying to remove the adhesions, or reducing or achieving the extensibility and flexibility of the shortened muscle, would definitely make a difference in the posture of the patient. And this everything, this all aspects can be achieved by Pilates training. It is used in post-surgical rehabilitation. Post-surgical rehabilitation, the general protocol of that would be wrong on my part to say the general protocol. The condition-wise based protocol of as physios which we give to our patients, why don't we add Pilates training from the beginning to those patients? Yeah, maybe Pilates training, you might be seeing that, okay, it is isometric contraction and then achieving the movement. I would say it is aligning your posture, then doing the contraction, and then achieving the strength. So, yes, it is widely used for post surgical rehabilitation, such as after spinal surgeries, joint replacement, to restore the function and the mobility. And who doesn't know Kegel's exercise? So Kegel's exercise, if you pay attention, Kegel is something which is again co-contracting your abdominals, your core. Yes, but attaining certain postures of Pilates exercise, which I'll be showing ahead. So those exercise, along with the traditional treatment, Kegel's exercise would definitely help the female to get back in routine when she's having pelvic floor disturbances. So physiotherapy, definitely it is very useful. And also in neurological rehabilitations like stroke, Parkinsonisms, few of the studies have shown that when Pilates is being given to a person who is having Parkinsonism, the festinating gait, repetitive movement, this had been overcome because now the patient, instead of getting nervous with the tremors he or she, they are trying to connect the chain right from your cervical to your foot. Then the kinetic chain is connected and the posture is achieved. So the tremor rate is reduced when a person is given, along with the respected neurophysiotherapy, Pilates is being added on in it. So yet, yes, it is helpful in Parkinson's, multiple sclerosis by enhancing the motor control and body awareness. Pilates, I would say it is actually something regarding to the body awareness and then application. So get aware where is the fault and then work on it. So it does makes a difference. So this was part one of the session, and we shall meet again. And I would try to speak on the same topic in session two. So stay tuned.